Hello, everyone, and welcome back to the Pursuit of Health podcast. I'm your host, Dr. Eric Fethke. Today, I had a wonderful conversation with a dear colleague of mine, Dr. Elizabeth Sassi. She is a nurse practitioner at a large public school in New York State. We talked about her journey from the beginning of the COVID-19 pandemic, starting in early 2020 to present, and looking forward in the future to some of the hurdles that still lay ahead. We talked about someone working on the front line in a public system that we often refer to in the news, everyone trying to get back to school. But who is there actually making this happen? Well, people like Dr. Sassi and her team. So please join us as we learn from her of her experience and the implications for all of us as we move ahead during this pandemic and into our healthcare system at large. Welcome, Lisa. We just finished, feels like weeks ago, but it was last weekend that we got together and tried to apply some of the guidelines regarding getting kids back on the field in our community from the American Academy of Pediatrics and anyone who was exposed to COVID. And during that conversation, and referring back to some of our other things that we've done together, we decided let's sit down and talk about what's been going on at the public school level. And I think that we've all heard a lot about this, so we're very happy to invite Lisa Sassi, who's the nurse practitioner at the Monroe-Woodbury School District in Orange County, New York, about an hour north of New York. And we realized that as we were talking, everyone is mentioning getting back to school and how do you open the schools and the hybrids and how the sports come into it. And, everybody hears this on the news, but who's behind the scenes doing this? How does this happen? It's not magic. Of course, there are administrators and superintendents, but this is a health issue, right? So there's got to be somebody involved at the school level. And of course, all of us know, having gone through school, that we have a school nurse, and you're the school nurse locally. And, we've been very involved in your community. And I think it was an idea we both had. Let's sit down and talk about how it is at that level, at the level where things are actually being done. So I'd like you to share with us so that people out there can kind of say, well, that's where I'm at too. And hopefully we can share some stories together, and other people can eventually, and we invite other people to make comments and share their stories, and hopefully get all through this together. So with that in mind, I thought if you would tell us a little about your school system, Monroe-Woodbury School District. Tell us a little bit about that.
Okay. Well, thank you for having me.
You're welcome.
So it's a good-sized school district, about 6,700 kids, about 45 minutes out of the city, maybe an hour, depending on how fast you drive. Most of our parents work in the city. So the kids, so there's a lot of connection with New York City. We have in our high school about 2,400 kids, middle school 1,700 or 1,800. It's
a big school.
Yeah, it's a good-sized school. Right. So our goal was always to get the kids into school. And our kids also go to different areas. So if they have special needs, they may go to BOCES, they may go to the Center for Discovery, they go to schools in Westchester, Rockland, kids with different needs.
And so that's a lot of coordinating, people moving around a lot.
A lot of coordinating, right? A lot of busing. And a lot of school schedules and closings to kind of keep in mind. Gotcha. And a lot of kids we want to bring back into the school.
And when you look at a school of that size and also the schools around you, would you say this is one of the bigger schools in the area, or is it the biggest school in this region?
I think this and the Newburgh Free Academy are the two of the biggest, or the two biggest in Orange County.
All right.
And we just sit right outside of the border of Rockland and really close to New Jersey. So we're kind of a quick commute.
Right. And
so we're the first exit off the throughway. So we do get a lot of, families from everywhere.
Yeah, absolutely. And the facilities itself, it's got to be one of the largest buildings in the southern New York State in terms of a public facility.
Yeah. Oh, it's a beautiful building. It's been maybe 20 years old,
That went quickly, yeah.
Yep. And it's a real nice, looks giant. It's right by the Woodbury Commons, which is a lot of shopping. And that brings, issues in itself because our students work in the Commons, which bring a lot of people that they're interacting with on day to day.
That's an interesting factor. Yeah. There's a lot of outside interactions
with the parents and the students who go right to work right out of the high school.
Got it.
Right down the road. So yeah, it's a big building, 2 gyms, 2 cafeterias.
And a lot of activities in the school, very coordinated. With all full disclosure, I'm a graduate from that school system a few years ago, before that new facility was built, and came back with my family to the area, and that's how we got involved. But always organized in a lot of activities, whether it be music or other outreach programs, and of course sports programs, and a lot of sports. And we're very proud of the fact that at one point we were actually state champions at Monroe-Woodbury, New York, and in football, that is. So that, we'll get to that in terms of the sports and how that interacts with what's going on.
Music, arts, great music department, great arts department, and sports. A lot going on, and a lot we want to keep a lot that the kids are missing.
Right. And a lot of it's, at this point where a lot of kids, and this, I think this is probably something the nation is sharing, trying to get the kids to move on with their lives into high school and out of high school towards college. So all of this has kind of been interacting and interrupted and slowed down. So there's a lot to handle, whether it's the sports, the education, everything kind of juggling. And you've probably had your hands full and have your hands full with that. But could you tell us a little bit, we all kind of remember where we all were when certain things happened that are memorable, not always in a good way. There's the 9/11. And, a lot of things like that we all kind of remember. But do you kind of remember as a nurse kind of where you were when you first started hearing something about COVID, this virus?
I do. It was, in school, there was a lot of discussion. And one of our guidance counselors actually followed it very closely, posts on it on Facebook. His name is Bob Oakes. And we would discuss it. And, we were just watching and waiting. I myself ordered the N95 masks. I put a quick order in just to have it ready, thinking, we need to be prepared. We had them in the past, but they had expiration dates. And so we put a quick order in for that. We were always good on other supplies. And we started watching and watching. And then as it hit Westchester County and that's where some of our families work. And, so we watched more.
Right. And that's right at the beginning. You're right.
Yeah.
Towards the spring is coming on in 2020. And there's that first sports issue coming on. Kids trying to get back into that in the winter sports.
Yeah.
And so your first inclination was to protect the kids, masks.
Yeah.
How did that go?
We didn't get them. We put the order in. It gets approved. There's a system. Yeah. And then as I guess other people thought the same, maybe not necessarily in schools, in priority areas, schools ended up shutting. We didn't know if they would shut. My nurses are great, and the superintendents and the principals were great at kind of listening and tracking. And as we were hearing, before contact tracing was a thing that we now I talk about all day, almost every day.
Yeah.
It was something that was starting to connect, and it was a coach who was at a funeral, and that was the first positive case in Dutchess, and his kids go, to our school, and now what do we do? And how do will they bring that in? And then it was a parent, that worked, and what did we know? What do we do? Are they going to bring it into our building? That was an elementary at K1. And
gotcha. So this is one county north of us here. And that was already, you're starting to see the interactions between different areas.
The funeral was in Westchester. The person who was positive was Dutchess. And the people that worked in our school and had a child was Orange. So it all connects.
Do you think that your background going on through nursing and nurse practitioner, did you kind of say, thank goodness I took that class, or I had that experience, or do you think some of your education prepared you in some ways for kind of trying to manage this? Was that something that you looked back on and leaned on during this time?
Well, I definitely think so. I mean, I have a kind of a big nursing background. I started nursing in 1982 and then kept going. And I used to do a clinical instructor at Orange County Community College, where you're always thinking about epidemiology, lots of
Right.
courses through the course of my doctorate. So I'm sure all of it played.
And so could you tell people what is epidemiology? Because I think that's important. We throw this around in our field's terms, and sometimes it goes, over. Somebody has to look at what is that epidemiology?
What is it? Yeah,
so what does that mean? Because that's relevant here.
It's so relevant. I mean, we deal now with the Orange County Epidemiologist Department of Health, and they are just fantastic. So it's how does diseases spread and how diseases grow. And so the epidemiologists are people that I are in contact with constantly. So they watch, well, you should do this. This is how, that's why the masks, that's why the distance. So how the diseases will spread from one person to another.
Gotcha.
And what we could do to protect the masses and what should we do.
So the epidemiology is the science behind the public health.
Exactly.
So it's, the public health being, how do we get the resources out to people to care for them or protect them or do all those things. That's the actual doing phase. But the epidemiology is how we understand what we actually have to do.
Right.
Okay.
And this is new. So
Yeah.
we're always learning.
Yeah.
You're learning about the effect of COVID on the heart.
That's
We're always
right.
learning about, and the CDC is learning, if they can, COVID quarantine times went from 14 days to 10, and now I'm seeing it could be 7.
Right.
We follow our local Department of Health. Right now it's still 10, and they wait, and you watch. You don't want to make quick judgments. You want to keep everybody safe, and so.
So with that in mind, I think we'll touch base a bit of that in a moment about kind of the interaction between a public school system and the state leadership and the county leadership and stuff. That is something we should talk about in a moment. But here you are back, is this February, March 2020?
February, I'd say, yeah.
And, you're pulling on your background. You're saying, let's get the mask. Let's try to, do some protection in public health and keep the spread down. And here it seems to be coming. And who did you kind of start working with in the school or around? What's the team that did this at the public school level?
It probably initially was right to the superintendent,
Right.
and she was, great at listening on a building level. The principal is right by there, and my other nurses. There's at least one in each building, 2 other nurse practitioners.
So that makes 5 or 6 people?
Yes,
nursing-wise?
6. We have 8 or 9.
Okay.
2 in a couple of the buildings, 2 in the middle school, 2 in the high school, 2 in one of the elementaries.
So give some people the size, the people listening a sense of the size of this school district, right?
Yeah. There's 7 buildings.
Yeah, right.
And so every building has at least 1 school nurse, which is great. Not every school's even have that. And they're
Right.
registered nurses in our district.
Gotcha.
And there's 2 other nurse practitioners and 1 going for a nurse practitioner in our district as well.
Gotcha.
Our nurses teach health too. So they really do a lot about epidemiology, hand
Right,
washing,
right.
germ spreading. So they, at the elementary levels, K through 6, they're health teachers. So
Gotcha.
they really,
And that must be good for the students too, because, you're their teacher, you're their nurse, here something comes, there's that level of familiarity and trust that can
Yeah.
make it a little easier with the kids,
got
especially
this,
the
right.
younger ones.
yeah.
And so you had this team. So how did you guys approach this? What did you do initially? Did you say get on the phone and go hi, or were there huddles and meetings, or what was the approach at first?
Yeah, it was a lot of phone calling at first. You'd get calls in and you have to react like this was exposed and should this child go to school? And sometimes it's multiple buildings. So
Right.
you'd have to be speaking with the principal of the building, the nurse of the building, and then back to the superintendent at that time. Right now, the head of human resources in our district, Matt Kravitz, is the co-chair
Gotcha.
of the COVID, or he's the chair. I'm going to give it to him
Right,
of
yeah.
COVID. So because it affects staff and students, so we have to team up together with the staff and the human resources part, and the students would be my part. So right now, he's it. But
Right.
at the time, it was Mrs. Rodriguez, and we would talk
Your
a
superintendent,
lot.
right,
Yeah, our
yeah.
superintendent. She's great to work with, and it was confusing. We weren't sure how
Right.
to
How
start.
was that? Right.
Where do we
Yeah.
begin? When do you close school? And she would have direct conversations with Dr. Gelman, who's our commissioner of health in Orange County. But she at the time, I think Bergen County in New Jersey shut its schools briefly, probably the day before we did, and that went through the county executive. I
Okay.
saw it when I was down in New Jersey. Get
When
a
that
car.
happened, yeah.
When it happens. And I read it and I said, to Mrs. Rodriguez, I see that Bergen County went through the county exec, and I know she touched base with superintendents and had a conference with Stephen Newhouse, who's our county executive. And so she was meeting with them the next day. Our numbers were starting to tick up with just...
And this is when? Give us a reference.
This was March 10, 11, something in that range.
Right. So pretty quickly from the time that we all hear this is here in February, now you're in early March already, and you're talking about school, shutting the schools down.
Schools closing. We had no students positive reported, but we had parents of students. And back to the unknown, it was a little bit concerning. Could the kids be there? And, you're contagious 2 days, back to epidemiology.
Right.
Like chickenpox, before the onset, before the rash comes and chickenpox, you're contagious. So is this what's going to happen here?
Right.
And should we allow the kids into school and then they're feverish a day later and now we're exposed? So she, after a lot of conversations, is ready to shut our school probably a day before any of the others did. And that was the day of her meeting with the county execs and the other superintendent. And then I think most schools kind of ended up shutting down.
So this is a very, busy area. We're in the Northeast. You're talking New Jersey and counties that are growing with high populations and a lot of people. And so this is a lot to handle. And I'm already hearing that bridge between the school, the local infrastructure, administrators of school, and our government representatives already are starting to have to interact.
Right from there, they were having, and prior to that date, I'm sure. Yeah. I just didn't know how many, but I'm sure that they were, because they were in dialogue with, I think, plans. I mean, nobody knew exactly how things were going to roll out, and I think everybody was hoping that it wouldn't close schools for as long as it did. But there was that unknown period, and I think we all took that pause. And we have to remember that New York, in particular New York City, was kind of the epicenter at that point. Yeah. We're starting to realize, okay, we're going to have to lead the way and figure this out. And, when you talk to people, the parents and the students, how did you all take what you were doing and that meetings and trying to take guidance from the state and the local governments and then through your own infrastructure, and how did you translate that to the students and their families? She's pretty good with communication. We do have a communication director, Carol, and she really helps a lot. We had I think they immediately started thinking about things like Chromebooks for the students, that not everybody had access to computers, and you wanted equity in schooling. And so they were ordering that already, probably before. I remember seeing the superintendent for the computer.
Right.
I can't remember his title, but and we talked about it in the hallway, like, and he was already kind of working it out. How do you do it? How do you get it past everything? School's budgets and approvals and, and how do you roll that out? How do you get it to the kids? And so they did place an order early on as well for Chromebooks for each and every student. So everybody has a device, but that took a while. I think other districts, not all of them, because we got ours, but, started thinking of that.
And was that through the Department of Education, the board? Was there community feedback so that, you could kind of figure it out on your own? We're going to need to do this. But was there interaction from the community at that point saying, how are we going to do this for our kids? And therefore kind of a collaboration with the community and the school?
The school board is very active. They interact a lot with Elsie. So I know that they were proactive at approving it, and they are very involved in the community and reaching out, as well as Facebook and any other source of community reach out, outreaches like Monroe Matters or our kind of,
and a very robust website. And so what you're saying is the social media aspect of this was key to communicating, and you already kind of had that in place, but maybe not everybody does, or not every school system has the resources that your school system does. And so you're starting to see in a public school system what we saw in the hospitals, the non-private hospital system, that not everybody was equal, and that was going to have an impact on what a school could do for their students in their community or not do, and the resources. And all of a sudden the inequities start to show up. Right away. And when did that kind of hit you? Was there any particular time where you said, this is, we're fortunate, but they're not, or something? Do you remember kind of thinking about, wow, why isn't this more equal in that sense? Because in New York, we started trying to make the field a little bit level for the hospitals in terms of resources. But was there anything like that happened?
I know it was in the works through the computer center, trying to access that, and how would they roll it out. We, and I think we'll talk about it later, we do have a population of students that are migrants. They come here, and a lot of them, more and more, and from different countries. And so they don't know the language, and how are they going to log on? But we also had the teachers who have to now teach online, which we never did before. You know, whereas, you know, us older people are not as good. So the district started there. I think I had already had a Google Classroom set up with our health ed teachers, but we didn't teach from it. And I didn't, you know, we didn't know that much, but I had learned from one of the younger teachers who teaches health at Jess, right, who teaches our 7 through 12 health ed. She's real good with the computer. So she had kind of got us started on it. So we had some curriculum in there, but now we had to learn how to do everything on there and roll it out. So the district provided a lot of in-services for that. We could become Google certified and Google Classroom certified. And that was kind of how they started. So post a lesson, but they wanted the teachers and to know how to teach. And that's a lot. That's a lot of change. Right. It's different and it's not ideal, but it's what we had to do. And they did. They learned it. So
the health issues that you're dealing with epidemiologically and everything are clearly, because we're spending a lot of time, understandably, talking about how it affected the education. But behind this is the desire still to keep everybody safe.
Right. Yeah.
You know?
And then and the equity piece. So then came the other pieces. Yeah. What if they don't have internet? What if they're in multifamily home? And they did reach out, and they you know, there was a lot of grants and things out there, but they supported those families, whether it was through a hotspot, right, so that their kids can access it.
Right. So the shared hotspot technology, it reminds me, was some of the pictures behind you are from other countries where I've been, and one of the places was South Africa. And I remember when we were in the middle, at that point, just in 1982, I had left high school, and then in college and through medical school, finally went into South Africa to do some work. And that inequity was clearly there in apartheid. And the aspect of technology, not even having electricity in certain areas, you know, became an issue for them as a country and their economy and everything. But, you know, it's funny for us to step back and look and admit to ourselves in the United States, well, we still have some of those issues.
Yeah, right. Yeah. These are multifamily homes, you know, you can have in one building, you know. So I did volunteer through the Medical Reserve Corps at the health department when we first shut down, because we were not up and running our Google Classroom stuff. So I went down there, and they were great. And we started contact tracing, which was new. And I was, you know, just who were you in contact with?
But that implies testing now is coming in.
That was right in March. Some testing was not many.
Right.
It was not soon. It was maybe a week or two after school closed. Okay. Maybe a week. And I live in Goshen, was right there, and I went down, and they were beginning that, but it made sense if I was in contact with you and you were positive, and you know, so we were, you know, just starting a sheet and doing a spreadsheet, and now it's bigger and bigger and bigger. Right. And then there was an address that was familiar to me from working in my area, and I said, there's no contacts. And it was a Spanish-speaking man, and we had a medical student from Toro doing the contact tracing because he was bilingual. And I said, wow, that might be a multifamily house. And sometimes even in those areas, they may just be renting a room with a bathroom, and there may be shared living spaces, which then could lead to this person and that person, you know. So I was thinking there was more, but you know, it was maybe a person that wasn't legal to this country, or, you know, what the terminology is, was afraid, an undocumented person, and they may have been afraid to even share.
To come out and say, look, I need to be tested. I'm not sure.
Further, and tell more people that are there. So that was a whole nother worry to me about our students that may be there as well. But they were afraid.
And you were using, and you kind of alluded to it, that we have a medical school in the area. Now it's about 6 or 7 years old. And you were using the students too, because those were students that were also kind of in lockdown.
Yeah.
Those medical students in our community were not able to do all the things they want to do. So to keep them busy, now they're doing contact tracing.
Yeah, they were great. I mean, I didn't do many days. Then we started having to do the curriculum. So, but with the days that I was there, the students were great and jumped right in. You know, it's a pandemic, and it was
Very fortunate for our community, yeah.
To have a bilingual person there talking and very eloquently asking questions, it was good to see.
Yeah. And do you think that now, there's that time where all of us kind of knew that school kind of ended early and we all sat down there for a while and summer came early and basically trying to get back in. Take us through that time as we're trying to get back in. What was different as you were trying to go back to school for the next year now?
So that's when more Google Meets or, we didn't do Zooms. I think there was some problem with them. Right. Started where you were trying to, and I volunteered to be in the New York State task force so I could see what's going on everywhere. So, I knew we were a pretty good, our school district is big and it's close to the city enough that we kind of get a good view of both things. We also have some really rural areas, people, farms, and that's what it used to be. And now it's bigger and bigger. So I wanted to see what was going on in different districts. And we were doing everything right. But that led to then meetings within our own task force in the district. Like, what do we do? How do we bring them back?
So it sounds like there's a lot more at that point as you're trying to open up. Every equal step back. And that's always important to do. I believe in that concept of just everyone step back for a moment. Let's take a look and see where we're at. So we took the kind of early summer and through that time to do that. But by the time you're emerging, there's a lot more structure to this now.
There was a lot of structure and there's a lot of fear. Yeah. And there was the teachers and the students, and do you offer hybrid and do you offer, totally remote and how do you get them back in and how many days and how many do we bring in with a building of 2,400 if they all chose to come back? Yeah. Can we keep them 6 feet apart? How do we do the hallway? And we have a very large building because our building's new. Right. And but other buildings are not, even in district, and other buildings are not in the state. So you had to have some consistency. So how they rolled it out was 25%, which I actually worked out good. It gave everybody a transition to get in, to figure out, when there's a positive case in a classroom, how do we quarantine and how do we do this? And
without shutting down the whole system again.
Right, because we didn't want to shut the school. And I think a couple of times we did shut, and then now we probably wouldn't, but you're losing some teachers because the teachers had to quarantine as well. And then can you get subs in, and are the subs afraid to come in, and are the, so there was a whole lot of fear and question. And,
so you were learning together. And I think that's a lot of what we say in healthcare in general, whether it's in an office with patients, and here you are as a nurse in a school system, and you're saying we're doing our best, really is what we're doing. We're using all our resources to try to figure this out as we go and use all the resources that we have and learn as we go. And ultimately, it's interesting that you mention the architecture of the building.
Yeah.
Because you start to realize that has implications. We saw that in healthcare, that certain offices, certain facilities were not amenable to keeping them open at that point where others you could.
Right, because you need to be apart. Yeah. And you need a newer structure. And our building is big with a lot of airflow. We did have just a meeting again yesterday, like re-looking. And there was the airflow, is there enough exchanges and different things that would come from that piece. And my piece was the medical piece. And so how do you keep everybody safe?
Yes.
We get them back in. We know we want kids in the buildings, of course, but how do we keep them safe and in? And then it's a learning and growing.
And do you see now that, people got back into school, there was a little ups and downs with that across the country, and we all heard that day by day. And again, people like you are in the background with that, trying to keep it moving forward. Do we shut down again? Do we do this? And make those decisions as you go. But as you look back now at this, and we're obviously not out of it yet, but would you point some of the things that you really kind of say, well, these are principles I've learned now that work, some of the things that I think do work as a nurse and the epidemiology and to keep the school open and to keep the education going, and some things that are still issues? What would you say?
Yeah, so we are pretty good about keeping apart, and we do learn and keep changing. The holidays were hard because the gatherings, and the gatherings led to much more spike in cases. And then so we took a pause. And mid-December, should we open for the week and a half where the kids would have been physically in the building right before Christmas for 3 days, because it was every other, we're 2 day a week. And So they just kept it paused, which I felt was the safest given the rise and the amount of quarantine. Now we come back, we want them back. So the pause is over. We got to try.
Yes.
So now comes what else do we do? We are apart. The kids are so good coming in. We do a screening at the door. We do a temp check. There's their weight. They give you their name. They are just so good. They keep their distance. They always wear their mask. But you want it to be a joyous place for them too. So you greet them, as friendly as you can, and you let them say hi to their friend in the hallway for a minute. It's not a contact if it's a minute.
Right.
It's a social interaction, a greeting, and they can move on. And you want them to do that. So you don't want to.
You must face some people in the school system, or the parents, or even those kids who get worried about those interactions, and you have to calm that.
The kids, some in the beginning would come scared.
Yes.
Can I report this, and will you keep it anonymous? And we do address it. Of course, we'll go and say this child is not reporting you. You do it very tactfully, but we just kind of make sure that
as a supportive
they're
thing.
a part. Yeah, they're scared, and we want them in.
Feel safe.
And so that happened a bit in the beginning, not as much now. Parents still do that, and we actually did a Crusader chat, that's going to be blasted out that I spoke at as well. And that same thing that we really keep an eye on them. I feel the school is safe. We do have to quarantine. So what I wish and hope for down the road is a little more consistency between the county health departments. Our county health department is great. The epidemiologists are the best to work with. They are bombarded yet pleasant and follow right up. So they're wonderful. There is differences in counties, which leads to questions from parents, including parents who teach or work in other counties like Westchester, like Bergen County, And so then, while in Rockland County, it's the whole class doesn't have to be quarantined. And why does Orange have to do that? And so that would be something. And I know it depends on numbers, but with all things being about the same, could we have consistency?
It's confusing to people, and it creates when you're trying to work. We see that here too when you're trying to just keep above, and then you add that other layer of people stress getting worse because they're confused about why things are different, and it makes it hard for them to navigate, like you said, from one community to the next community.
Yeah.
And so they bring that to you. They're a nurse, they're the clinician, you're the guide there, and I think that's a very important role we play to educate people, to try to explain it. But you're saying, to some degree, moving forward, it would be better if we were more consistent across these things.
I think it would make it easier for the parents, whether, if their numbers are dipping, and their percentage rates are 4% and we're 5%, but it might be easier if there was a little bit more clear, because it's hard for the parents, and not all of them. They listen and follow, but it is hard. They want their kids in school. And if they're the principal in a school in Westchester County and they don't quarantine unless they're 6 feet close, and we do because we follow the health department for the whole class, they don't understand it. Yeah. And I get it.
It gets a little,
but I get our side too. I'm kind of our health department's great, and I think they don't want the spike. So I get it, but consistency with them would help.
Therein lies the overlap and the conflict. But, but so you're saying that the key so far, the lessons that you've learned so far with this have been, keep lines of communication open.
Yeah.
Have regular communications and meetings with your own team. Keep lines of communication with the community open. And then when you are anticipating a spike or a situation like doing that, be prepared for it. Make sure you don't bend the rules. You follow the guidelines for the temp checks, even though, we're not sure that means every single kid is sick, but we're, trying to be consistent at least. And you're saying, if we keep doing that, then we can get through these without shutting down the system each time.
Yep.
And whether that's a new strain that comes in the future or all those kind of things, these are the principles that seem to work. Communication, consistency, and that consistency perhaps not just within your own school system, but at a more broad geographic level too.
Exactly.
Yeah, I think a lot of people would feel a lot calmer if that could happen. Yeah, I see.
I mean, you saw the governor with the mayor and the city, all of these conflicting, and that's not easy to watch after a while.
Not for any of us.
And so you'd hope for something more consistent.
Yeah, and I think they're human
truthful
beings too, and they're trying to do their best like all of us. And And you're right, to some degree, when you're in that authority role, in healthcare, and I think what's nice about this personally is to see that the nurse is involved in a healthcare issue. It's very often that we see that a lot of other people get involved and want to kind of control it because everybody wants to, make sure that it works. And I get that. And they're not doing it for negative reasons, but this is a health issue, and it's nice to know in this large school system that the clinician, has been involved in that. And I think that's important, and I hope that calms people too, and that we are doing your best. And when we see, our politicians and our representatives trying, at least they're turning back to our Commissioner of Health, or turning back to their, Department of Health people and doing that. And I think, to me, that's hopefully reassuring to people too, that somebody with an epidemiology background in nursing, who's part of the community and been here for a while, has been involved in the process. I hope you all enjoyed our conversation with Dr. Elizabeth Sassi, a nurse practitioner in a large public school system in New York State. I believe that with people like her, especially with her epidemiology background, that we should all feel much calmer that our children are being watched by people who care and have very good experience and knowledge base as we go through this pandemic and other future such issues. I know that not all school systems have resources such as Dr. Elizabeth Sassi and her team, but I believe we can learn a lot from what they have been through for other places as well. So, if you have some comments regarding this episode or any of our other episodes, please feel free to reach us at drfethkemd.com. That's drfethkemd.com, or Dr. Fethke MD on Facebook, Instagram, Twitter, and now TikTok. And I wish you all well as your host, Dr. Eric Fethke, in all your pursuits.